Medurstand Understanding Medicine.
I'm Professor Aziz Rehman from Medurstand-Understanding Medicine. And today we're going to talk about this very interesting and important concept called holistic approach to the management of diabetes. I've got several videos on different aspects of diabetes, but this you can take as a summary covering all components of diabetes which we need to cover, which we need to treat so that patient can have a comfortable life without morbidity and without mortality. Translate into practice. So these four alphabets A, B, C, D of course can be easily remembered, and A stands for A1C. A is derived from HbA1c, and that means glucose control. And this HbA1c should be individualized. As far as ADA guidelines are concerned, for majority less than 7, but in some individuals you should achieve better one. And blood pressure, again, individualized, because the blood pressure which may be considered acceptable in a non-diabetic may be considered high in individual with diabetes. And similarly, cholesterol, we have to control all components of cholesterol. We will talk about those in detail later. And then use of aspirin in some selected cases, maybe not in all, but in some cases. The last thing is the aspirin. Aspirin is, very popular drug, and I've taken this word D from one of the brands. And aspirin, the role of aspirin in primary prevention is actually not 100% agreed upon. Now let me explain this. Primary prevention means that somebody has diabetes but has not yet developed any manifestation of atherosclerotic cardiovascular disease. So there it is called primary prevention. And the trials have shown some 12% prevention of ASCVD, but almost an equivalent rate of complication, GIT side effects. So there is not a very strong and convincing case for routine use of aspirin. But those patients who have diabetes but they fall in a high risk group, like they smoke, they have dyslipidemia, they're obese, they have a strong family history, I think even if they do not have atherosclerotic cardiovascular in themselves, I think they should be considered for aspirin. So I tend to prescribe in high risk patient, and if they have GIT problem, then I withdraw it. But in low risk patient, I tend to hold it for future. And in secondary prevention, if somebody has got any manifestation of ASCVD, like angina or angioplasty or TIA or stroke, I think it is mandatory to give aspirin. At least maybe some additional therapy is also double antiplatelet. I think it is a standard practice. If somebody has established ASCVD, we give aspirin, sometimes 75 milligrams, sometimes even high dose, 150 milligram with clopidogrel, 75 milligram. The rationale of combining these two drugs is that both of them, they do not work in 100% of the patient because there is some polymorphism. Aspirin and clopidogrel, both they do not work in 100% of the cases. So if you give both drugs together, then the chances are that majority will have effect to at least one of them, if not both. Although combining these two drugs then also put the patient at a high risk of bleeding, whether obvious bleeding or bleeding in the form of developing later anemia. So that is why I think all these patients who are put on aspirin, they should have a periodic check on their hemoglobin, and if the hemoglobin is dropping, then maybe you can have their fecal occult blood. Then you use various strategies. I think adding omeprazole or famotidine can help, or maybe if patient is taking double antiplatelet, you can reduce it to 1, or maybe you can supplement with the iron. So some kind of strategy should be used, but I think you should try your best to a patient can stay on aspirin. So use aspirin 75 milligram in high risk patient if tolerated well in all. So this is the lesson. Diabetic patient. So this brings us back to alphabets of holistic approach. A1C should be less than 7. Blood pressure should be less than 130/80, preferably by using ACE inhibitors or ARBs. And cholesterol, LDL should be less than 70, preferably using statin, but other agents are available. If you have ASCVD, then less than 55. Then aspirin in all patients who can tolerate, all diabetic patients who can tolerate, but specifically in those who have some manifestation of ASCVD. So that is what was meant by holistic approach. Glucose remains in the center. We must try our best to bring down glucose, and we must use all the strategies to bring down blood pressure and cholesterol, dietary changes, and also the medication. We must control weight, again dietary changes, medications are also available, and we must control smoking, willpower, counseling, and medication is also available. So this will hopefully bring down a big morbidity and mortality to a low level. Probably patient with diabetes and associated condition, despite using this approach of holistic approach, their morbidity and mortality would probably still stay higher than another individual of the same age and gender without these complications, without these conditions, but still we can bring it down from 75–80% to maybe 20%. Thank you very much for your patient listening, and I would request you to join my other videos also. This has been Professor Aziz Rehman for Medurstand-Understanding Medicine.